Welcome to a Divided Kids learning session. We started with the social skill development problem series, and last time we talked about a problem behavior attached to social skill related improvement, and we talked about the second component of problem behavior, and that was related to attention problem or overactiveness of the children. And nowadays, most of the children, they display more or less some kind of attention related problem. And if this problem is not taken care adequately and sufficiently, then such problem can accrue and make a bigger problem in the future when the child grows up. So in this series of attention problem or overactiveness, we have got 8 checkpoints. Through these 8 checkpoints, we deal with various symptoms which indicates that such kind of problem may be taken care of adequately, and we parents or teachers should give lot of attention to those symptoms to ensure our child is not having any kind of problematic behavior whatsoever. So under this, out of these 8 symptoms or out of these 8 checkpoints, the very first checkpoint deals with the impulsive behavior of the child. So the very first one, we have to check if the child acts impulsively without thinking. This is a very common behavior among the children in the age group of 2 to 6 years. But if we are not aware enough about this, then this may lead to a bigger problem in the future. So under this, what we have done at Divided Kids is that we have come out with a method which is called 4D method, and this 4D method will help the teachers and parents to track and check if such behavior is present in our children. So what we are going to do in maybe next 5 to 10 minutes time, we'll talk very crisply about this 4D method and how this 4D method will empower us to check if our child is having impulsive behavior or not. Let's go ahead to see what this 4D method is all about. First D of this 4D method talks about the child has difficulty in waiting turns. As we know, in preschool curriculum and preschool teaching mechanism, Montessori method or the play method is very common and very effective for the overall skill development of the child. And in most of the play method, what happens, there will be various play, and most of the children, they come together and they play those play methods or various games. Now, while various plays are played, then a child has to wait until his or her turn comes. Take, for example, the Ludo. If Ludo is played among 4 children, then one child has to wait at least some time until next 3 people or next 3 children, they just throw the dice and finish their turn. Then only another child's turn comes. But sometimes we may realize some of the children, they are impatient to wait for their own turn. If there are difficulties, if the child is really behaving impatiently to have that particular activity done without waiting for others to complete, that is a clear-cut example of impulsive behavior. If such kind of behavior is present while doing various play or various games in the school, then we have to be careful and immediately we have to take action to reverse this kind of behavior. As we have already discussed that in the age group of 2 to 6 years, it is very easy to change such kind of behavior. But if we are not aware enough to notice such behavior and ignore those things, then it becomes a bigger problem, and changing at the latter age will be bit difficult. So first D, remember, it is difficulty in waiting turns. If present, we have to take care. Now coming to the second D talks about destroying of own or others' possession. And such behavior, if we are connected to any school or multiple children, we may come across this behavior. Seems to be very common in few of the children. What they do generally, even if it's their own stuff or it is the stuff of somebody else, then they try to break it, they try to destroy it. Maybe it's a pencil, they try to break it, throw it. If it is a book, then they just tear the pages of the book. So this kind of behavior leads to impulsiveness. And if such kind of symptoms present in any of the children and where we have taken their responsibility, then we have to act very, very systematically and very effectively to reverse and change this kind of behavior among children. So this is the second thing. If the child is destroying any of the possessions, either their own or somebody else, then we have to be very, very attentive and make sure such kind of behavior is taken care. So this is the second D. Now moving to the third D. Third D talks about disturbing other children in their vicinity. If a child is in a group or child is with another couple of children and some of the children's habit is to create nonsense or create problems for others. It could be of any symptoms. It could be just pull their shirts. It could be pulling their possessions. It could be just pulling their hair, or it could be just poking them. So any kind of behavior which disturbs others, that is also a kind of impulsive behavior of the child. So in this kind of situation, the child doesn't think while doing various things. It comes automatically. And if it is not checked, if it is not intervened, then it becomes a habitual behavior of the child. Therefore, for the teachers, it is important to keep an eye on the child if the child is behaving similarly by disturbing other children. So our third D is to check if the child disturbs others in the class or in a social gathering. Then moving to the fourth D, which is the last D, and this talks about defense without listening the issue. Sometimes we realize children, sometimes without letting others to finish, basically the seniors, either it's a teacher or the parents, without listening them properly, without letting them finish completely what they're just trying to say, they simply jump into that and try to tell something which may be completely not related to the issue that is being discussed. So if such kind of situation happens, if we come across any children jumping into discussion and talking proactively without listening to others or without letting others to complete, that also categorized as a kind of impulsive behavior of the child. So fourth D is about defending self or defending others without listening the issue. And if such 4 Ds are present in any of the children, then we have to be very, very careful and make sure that we have our techniques that will take care of such kind of behavior among the children. Now, what we need to do in the school to take care of such issues if such issues are present in some of the children. So these 4Ds: difficulty in waiting terms, destroying own or others' possession, disturbing others in the class, or difference without listening to the issue. So first and foremost thing is that we have to be attentive enough to identify if such behavior is present in any of the children. If in any of the children such behavior is present, we have to make a note, and first and foremost thing is that we have to make a proper communication with the parents, so that parents are also aware that such problem is present in their children. So sometimes what happens as teachers, we give lot of importance to change such kind of behavior. If such action is not supported from the parents, then it backfires. All the attention, all the precautions that is taken in the class or in the school, if it is not complemented at home, then all these things will go futile and this will not make changes in the child's behavior. So it's very important for the part of the teacher. Teacher has to notice it, make a communication to the parents. This meeting can happen in monthly meeting. What Educated Kids is suggesting, to have a monthly meeting with the parents, so that regular intimation, regular communication can go to the parents. Now, second important thing is that parents has to accept as a part of little bit of behavioral issues in the child. And once we accept it, we are open to make changes. If we do not accept as parents that our child are having some kind of impulsive behavior, then we will be having no scope whatsoever to make such changes. So making the parents open to these suggestions, open to the information that's coming from the teacher is very, very important. And second strategy would be just making the child aware, or making the child just to think, stop and think why they are just doing that. Even bringing that awareness in the children helps a lot by modifying such kind of problematic behavior. So these are the few simple steps which helps to make sure that the child's behavior is really reversed and right behavior is inculcated in the child. So these are the few strategies we have to keep it in mind, and how to evaluate it. So in a year, at least we have to do 2 times evaluation of this particular impulsive behavior among the children. It could be once in 6 months, then you have to take time. If we are just doing today, then we have to repeat these checkpoints after 6 months, so that to ensure that child is not displaying such kind of behavior. And providing a kind of objectiveness to this whole checkpoints, we have got the scoring system in place. Last time we discussed the scoring system in details, but to recall again, if any of such behaviors is not present in the child which is desirable, then we give a score of 0. And if the child either of this behavior is showing, then we have to give a score of 1. And if sometimes the child is behaving this kind of behavior, we give a score of 2. And if the child is very often in displaying such kind of behavior, then we give a score of 3. So out of these 4 checkpoints, so our total maximum score would be 12 and total minimum score will be 0. So if any of these checkpoints, if we get a score of 0 to 4, then we should be happy that our child is absolutely fine as far as this impulsive behavior is concerned. And if the child is showing some around 4 to 8 score, then we have to be bit concerned, and such behavior reflects some kind of moderate impulsiveness behavior in the child. and we have to act accordingly by looking what kind of behavior the child is basically showing. And if the score is between 8 to 12, then the impulsive behavior is at little bit of higher side, and in that case the child needs lots of counseling, and child needs lots of attention from the parents. And if it is not subsidizing, if it is not reducing, then we may take help of a psychologist through their professional expertise. They may bring some changes in such behavioral pattern. So that's all about checking and tracking the impulsiveness in the child's behavior. And I'm sure this kind of checkpoints is going to help us in a big way while we make our child's future absolutely fine. So that's all about today about the first category of problem behavior under this attention problem. And next session, we'll be talking about the second point under this attention problem or overactiveness behavior pattern of the child, which deals with if the child makes lots of noise that annoy others. So this is also another big area of concern as far as the behavior pattern of our children is concerned. So we'll be waiting up to our next session to discuss on that particular checkpoint. Up to then, thank you so much for your patient hearing, and we'll be there to support you if you have any specific issues and other things. There are various psychologists who work with us who can take care of if there will be any issues related to your child. Thank you so much, and seeing you in our next session of skill-based learning about our children. Thank you so much.